There's a question men over 60 ask me all the time, but usually in private. Dr. Ashton, how many times a week should I be having sex at my age? Is it normal that I can't perform like I did when I was younger? And honestly, the fact that this question gets whispered instead of discussed openly is part of the problem. Today, I'm answering that question clearly. We're talking about how often is healthy, what's realistic, and why the number matters way less than you think. Because here's the truth. Sex after 60 isn't about keeping up with your younger self. It's about connection, pleasure, and understanding how your body works. Because what I'm about to share around the halfway point will completely change how you measure sexual satisfaction. If you want straight answers about men's health after 60, no shame, no judgment, just science, hit that subscribe button because we're going deep today. Let's start with why sex changes after 60. Understanding the why helps you adapt instead of fighting reality. First, testosterone naturally declines. This hormone fuels libido, erection quality, and energy. It starts dropping after 50, and by 60, the decline becomes more noticeable. This doesn't erase desire, it just softens it. You're not broken, you're aging, and there's a big difference. Second, circulation changes. When you were younger, blood flow to the genitals was strong and instant. As you age, especially if you're dealing with high blood pressure, diabetes, or cholesterol, blood moves more slowly. Erections depend on blood flow. Less circulation means weaker or slower erections. That's not failure, that's physiology. Third, medications. Many men over 60 are on drugs for blood pressure, diabetes, or cholesterol, and many have side effects that affect sexual function. Beta blockers can reduce libido. Diuretics can affect erection quality. If you're noticing changes and you're on medication, talk to your doctor. A simple adjustment can make a huge difference. And finally, psychological factors. Many men feel like they're not the same as they were in their youth, and that mindset alone creates stress, which kills erections faster than almost anything else. So here's the summary. These changes are normal. They're not a disease. They're a new phase of sexual life that requires awareness and adaptation. Now the big question, how often is normal after 60? Here's the truth. There is no universal number. It varies from person to person. Studies suggest that the average for men in this age group is once or twice per week. Some couples are perfectly satisfied with once every 10 days, and that's fine as long as both partners are happy. I had a patient 65 years old who has sex with his wife twice a week and feels great. Another patient, same age, managing diabetes and high blood pressure, is comfortable with once every 2 weeks. Both are normal because each found a rhythm that matches his health and relationship. The important part is listening to your body. If you feel energy and desire, go for it. If you're drained, reduce frequency. There's no scoreboard. The goal is satisfaction, not performance. Now, here's where most men get stuck. They ask, "But Dr. Ashton, I can't last longer than 3 minutes. Does that mean I'm failing?" Absolutely not. Studies show the average duration of intercourse at this age is 3 to 7 minutes, but focusing only on penetration time is misleading. Foreplay, touching, kissing, holding, whispering, these can last 15 to 20 minutes and matter just as much, if not more. Emotional closeness and affectionate moments are the true foundation of intimacy. Don't measure success in minutes. Measure it by happiness and connection. How do you know if you're doing too much or too little? If you feel exhausted, short of breath, or have chest pain after sex, the frequency or intensity is too high for your current fitness level. That's your body telling you to slow down. If there's emotional distance or disconnect with your partner, that might signal the need for more physical intimacy. Balance is key, not excess that strains your body, and not neglect that weakens your relationship. So, what can you do to improve sexual health after 60? Here are strategies that work. Physical health. Walk 30 minutes daily. This boosts circulation and supports erection quality. Eat nutrient-rich foods: salmon, walnuts, almonds, omega-3s, zinc-rich foods. What's good for your heart is good for your erections. Quit smoking. It narrows blood vessels and weakens erections. Stay hydrated. Dehydration reduces energy and desire. Mental health. Don't compare yourself to your younger self. Your body is evolving naturally. Talk openly with your partner. Honesty reduces stress and deepens intimacy. Practice relaxation, meditation, deep breathing, yoga. These reduce tension and improve circulation. Supplements and medications. Some men benefit from zinc, vitamin D, or magnesium. Medications like Viagra or Cialis can help, but consult a doctor first. And never combine them with nitrate-based heart drugs. This can be extremely dangerous. Common questions. Does having less sex harm health? Not necessarily, but regular sex supports immune function, sleep, and heart health. Can too much sex be harmful? Not if you're healthy, but overdoing it can cause fatigue, especially with chronic illness. Does sex stop at a certain age? No. Many men are sexually active into their 80s. Others slow down earlier. Both are normal. Habits that damage sexual health after 60. Staying up too late. Sleep regulates hormones like testosterone. Excess alcohol damages the liver and nervous system, reducing erection quality. Ignoring chronic conditions. Diabetes, high blood pressure, and cholesterol directly affect circulation. Isolation and depression. Emotional health fuels desire. Here's my final message. Sex after 60 isn't a competition. It's about connection, comfort, and shared love. Taking care of your body and mind, embracing changes with awareness. That's the secret to a satisfying sex life well into your later years. If this helped you, hit subscribe. Drop a comment and tell me one thing you're changing based on what you learned today. I read every single one. Thanks for watching. Take care of yourselves.